environmental, and in children it could be something like viral bacterial infections. Since we talked about infection, I would also like to talk about rheumatic fever here as well. Again, very common in Pakistan, very common in children. It normally starts with a throat infection, a streptococcal throat infection, and then spreads to the joint. So if the child has got fever, sore throat, is very unwell, and complaining of joint pain as well, do keep an eye for rheumatic fever. And the third disease I would like to talk about is the reactive arthritis. And the good thing about this arthritis is that it goes away once the infection is completely gone. So reactive arthritis, as the name suggests, it's arthritis as a result of some infection. It could be the gut infection, the urine infection, chest infection, anything going on in the body can cause reactive arthritis.
And if we see that in today's era there's coronavirus, and how do you think people who goes through juvenile arthritis can deal with coronavirus at the same time?
First of all, they need to know which medicines they are taking. We are giving these patients immunosuppressive medicines. Common ones are like methotrexate, HCQ, silazodine, steroids. Most of the patients, they are on these medications. Second thing is, don't need to panic. Don't need to panic. Don't stop your medications.
Right.
If you're feeling unwell and you're developing any symptoms of coronavirus or any other illness, like any fever, any rashes, any sore throat, anything, please talk to your doctor before stopping your medicines. Your doctor can actually guide you about it. I've heard a very positive news about some of the medicines that we use in arthritis, like HCQ and some of the biologics, that they are actually protecting against coronavirus. So if you are on medicines, don't stop them without your doctor's advice.
That is true. That is true. That is very important.
Yeah, and I think that says a lot, because the first part because at the start of the show, me and Rida started off with the COVID-19 as well. The first part is, don't confuse the symptoms. That's very, very important. Look, there are a couple of indicators that highlight that, God forbids, you might have this disease, but it doesn't mean that even if you have one of them, it further proves that you're undergoing. This fear factor is always there. But definitely, I think the great part about this that Dr. Sadia mentioned as well is that this can be treated.
Be diagnosed.
This can be treated
as well. Exactly. And what is the stage when it becomes too late, and how effectively can it be treated if it is diagnosed at an early stage?
You know, the human joint is a complex structure, and in a growing child, the bones are growing, the joints are growing. The joint is lined by a synovial membrane that produces the fluid that lubricates the joint. It's basically the inflammation of this synovium, this lining of the joint. So once there's inflammation, it will first damage the synovium, the membrane that's producing the fluid. Then it will damage the cartilage, then the bone. So ultimately, the joint will become stiff and it will become damaged. So the aim of treatment and spreading this awareness is to treat these patients before any permanent damage has happened. So that is at very early stage. If you have any symptoms, see the doctor, start the treatment, follow the treatment plan, and your child can have a normal, healthy life. Okay.
That is
once the child has developed, Khuda na khasta, any joint deformities, like most commonly hip or knee or anything, the child will be limping, child will be disabled, he won't be able to do normal activities or sports activities. So don't give your child a wheelchair or crutches. Treat them early, get them diagnosed early.
Yeah, exactly, and not to take these pains lightly. I think this is very important in today's this segment, is that if you have joint pain, if you have pains in your fingers or anything like that, do not take it seriously and consult a doctor, because it is very important, because it can lead up to something serious if it is not diagnosed on time.
I think, Rida, we have a social taboo talking to doctors. Whenever you've got something and you consider going to a doctor, you probably, the fear factor comes in, or the problem right now mostly is that every one of us thinks we're a doctor. We're not. You can't
treat, Google does not make you a doctor.
With a Panadol, for God's sake. Joint pain does not go away with a Panadol.
Exactly.
So stop doing these things. But Dr. Saiba, what is the common misconceptions that, or you can say the mistakes that people tend to do, and then it becomes too late?
I think for children, arthritis in children, parents, they refuse to accept a diagnosis. They say, oh, it's the disease of old people. My child can't be having the arthritis. So first thing is that they need to know that this disease can also happen in children. And once, Khuda na khasta, it's out of control, it will be very difficult to save the joint. So this is one thing very important. Secondly, I would say that people need to have more awareness about these diseases, because when we talk about the diseases of heart or blood pressure or diabetes, people know they have to take medicine for the rest of their life or use insulin, for example. Same is with the diseases of bones and joints. It's something that's going on for a long time, and that will require treatment for longer periods, and people need to take medicines for longer duration. So same example I give to them. If you're taking medicine for diabetes, same is for your bones. Don't make this mistake that you're taking a painkiller, taking some haldi or something else, and you're curing your joint pains. Don't do that. Don't make this
mistake.
Yeah,
often people do that, or this is like put this turmeric in milk, just have it and it'll go away, or otherwise this dam durood concepts that are going around instead of consulting doctors.
So I wanted to ask was that because it gets really hard for the parents to experience something like that, because for a parent a child is the most precious thing. So is there any community in Pakistan of parents who faces through this?
Unfortunately, no. That's what we are talking about today, to spread this awareness so that people know about these illnesses. Like you mentioned, when I tell them about the diagnosis of arthritis in children, they straight away pick up their child and go to a dam durood or something else, and they will come back to you after a couple of months or couple of years when the child has developed a permanent disability. I have a couple of patients who are young adults now, but they can't live a normal life because they had arthritis as a child, and that was not treated because there was no awareness. Their mothers thought, oh, there's dam durood or something else, or use some home remedies and tourniquets, and now they have developed chronic deformities of these joints. So please don't do that. Please don't do the same mistake. Don't give them a wheelchair.
Yeah, like Dr. Sabha said as well, and I think it's equally important, like Rida said, to actually just not be aware of it, but you need to accept realities and the facts as well. Go talk to your doctor, and it has to start from the factor that probably the first step is realization. And then there needs to be I always say there needs to be a bond between you and your doctor. I don't know why we're stereotypically so disconnected.
I think this is very important, because a doctor can guide you in the right way, because this profession, they really care about people. I have many doctor friends, and the way they work 18 hours, 24 hours, 34 hours shifts. So I think this field makes you very compassionate about fellow human beings, and I think it is very important to realize that it is important to take consultations from a professional, because they're there for a reason. And if something like this, you experience something like this in your child, you should definitely go get some help.
But do you bother them a lot? Your doctor friends?
Exactly.
Then you're texting at every stage. Oh,
my friend, she came to Dholki, and everybody started questioning her. Okay, I have a fever. Okay, I have this acne. Okay, what should I do? And all her day was
Well, do you get that, Dr. Sabha? Does that happen in any family weddings or functions?
Exactly, same. But most of the family, they don't listen to your advice, because wo ghar ki mulki dal barabar, they don't listen to you.
But you're definitely surrounded by these people as well. But let's, for starters, this day is a great way of creating awareness and observing. What more do you think on part of the media or on part of doctors or even the general public out there need to do to work more towards this?
I think it's all about spreading awareness about these diseases. So I think it's a very good opportunity that you've invited me here in this show. I think media should talk more about these diseases. There should be some runs or walks or marathons about it. I think in schools we can have some learning sessions where we can teach kids about different diseases, and then we can talk about the personal hygiene and hand washing and things like that. So I think it's very important that our patients, patients and parents, they know about these diseases and they take quick action.
Right. Thank you so much, Dr. Sadia. It's always a pleasure having a doctor on that couch. I always say that doctors are superheroes. So we have a superhero right there.
Exactly.
No less than a Wonder Woman, superwoman that you are yourself, I think, making the society a better place for all of us.